Stakeholders have called for stronger collaboration between government and the private sector to improve cancer care in Nigeria, especially for vulnerable communities affected by conflict and insecurity. The call was made in Abuja by Barrister Chioma Uzodinma, chairperson of First Ladies Against Cancer, during a symposium focused on cancer, conflict and insecurity. She said Nigeria records about 128,000 new cancer cases annually, with insecurity disrupting medical supply chains and access to treatment, particularly for the 3.5 million people living in internally displaced persons camps.
Beyond the immediate human toll, insecurity disrupts medical supply chains, drives large-scale displacement, and breaks continuity of care. These conditions are particularly devastating for chronic diseases such as cancer, where timely diagnosis and sustained treatment are critical to survival. Across the country, more than 3.5 million people living in internally displaced persons camps face heightened risks of preventable and untreatable cancers due to disrupted health services, malnutrition, and untreated cancers. These conditions contribute to late-stage presentation, with studies indicating that over 70% of breast cancer cases are diagnosed at advanced stages, significantly increasing mortality and turning otherwise treatable conditions into fatal illnesses.
Also speaking, Godwin Kagio of Project Pink Blue stressed the need for stronger partnerships to ensure no patient is denied care due to difficult living conditions.
As we engage today, let us remember that behind every statistics is a human life. Someone's mother, someone's father, someone's child, or neighbor whose chance of survival depend on the decision we make and the system we build. We sincerely hope this symposium will not end in discussion alone, but will yield concrete recommendations, stronger partnerships, and a commitment to ensuring no one is denied cancer care because of where they live or the circumstances they face.
Former Senator Mao Onwabunwa urged the government to treat cancer care as an emergency in insurgency-prone areas, noting that while funding efforts exist, more support is required.
The government have been trying to ensure that they meet up the budgetary requirement, but it cannot be enough. It's not enough and will not be enough. That's why I'm actually calling that cancer treatment, especially in those areas of insurgency, in those areas that are difficult to reach today, should be declared as an emergency, and it should be part of a humanitarian program, so that when there are crises or insurgency or whatever, it should conflict. It should not only be humanitarian agency carrying food, but you should do something to inculcate and cooperate cancer patients.
Participants concluded that cancer control efforts must be strengthened, including expanding health insurance coverage and reinforcing the National Cancer Control Framework to improve access to treatment nationwide.